I want to say good morning and thank you all for logging on and being a part of our Windows on Waterloo. Our organization, the Waterloo Community Foundation, was started 5 years ago, and we wanted to make sure that we did what we were founded to do, that we wanted to go out and make sure the first year that we funded grants. And so we've been doing that for 5 years. And this year we realized too, not only should we do that, but I think it's important to build partnership within Waterloo so we know each other and what others have to offer so we can become a strong Waterloo. And therefore, we came up with Windows on Waterloo, and that's what it's about. Every month we're going to have another individual speak about his or her organization to inform the community on what's going on. Because in order to truly serve our community, we need to know our community. And today, before I introduce our presenter today, I want to talk about the protocol so we can make this very productive. Once again, our presenter today is going to talk is one of the 5 agencies we funded under the very successful First Responders Fund. During this meeting, if you can mute your computers so we don't have any backlash of sounds coming in, so we can hear Chris very, very, very well. And if you have questions, you can put them in the chat box. We will conclude the session at 11:45. And at the end of that piece, we're going to open it up for Q&A. And just for everybody to realize, so people could come back on and listen to this presentation later, we're going to record it for other people to listen to if they're not able to log on now. And we will be very interested in any feedback that the audience would have about this presentation. Today, one other thing, next month on October 1st, we have Joni Spencer from Youth, Together for Youth as our presenter. And as I said, each month we're going to have different presenters talking about different needs within our community and how they were able to meet that expectation of our community. Today, I would like to say thanks to Chris Kemp, the CEO of People Community Health Clinic. And Chris has been there since 1994, and she's a very valuable member of our community. She serves on numerous boards and committees to make sure that the greatest needs in Waterloo is met in meeting those needs. And at that point, I will let Chris take over. Thank you, Chris.
Well, thank you very much. And thanks for having me today. And I kind of a little nervous to be your first shot out here. So maybe I'll leave the bar low enough that everyone will do great after this. So
if I may digress, the reason we selected Chris, when we went around and gave out to five different organizations regarding the first responders, Chris was so energetic and has so much to say. We were outside of her building for a half hour just talking. So that is one of the reasons we wanted you to be the first, Chris. And thank you for willing to do that.
Well, thank you. Yeah, I'm always told that I open my mouth so many times that I end up on committees. So I do have things to say, but I do want to thank the foundation for the gift that we received during this period of time for all the COVID. The amount of support that we have received from the community has just been amazing and so heartwarming to see that people have paid attention to the work we've done and how we've been very vulnerable during this, and we've stepped up and have done a really good job. So I would just like to basically give everyone a brief understanding of our organization, of People's Community Health Clinic. I've been at the clinic for 26 years. I grew up mostly in Waterloo area, and I had gone to college at Iowa State, go Cyclones. And then after getting married, we moved down to Miami for a few years, have also lived in Milwaukee. But after all of that, really just wanted to come back home. We just really enjoy this community, and I think this community has so much to offer. And so all of our children have gone through West High, so our whole family are Wahawk alums, which is kind of fun too. but I've raised 3 children here and they're all doing well. So that's a little bit about me. My background then in my education is community health education from Iowa State. I have some other education from Cardinal Stritch up in Milwaukee for some graduate work up there. And then right now I'm in the middle of an MBA program at UNI. And so also trying to stay up to date on everything we need to do so that I can do the best for this business as I can. So I'm going to go ahead and share my screen and do a little PowerPoint, but please throw something in chat if you have a question, or if you want to come unmute and just ask the question. That works well for me too. I'd be glad to answer questions as I go also, or we can wait till the end. So everyone should be able to see my screen. So just kind of just a little introduction about People's Community Health Clinic. And a little background about us. We were established in 1976 as a community health center. I think we started the work on it prior to that for a few years. And I need to move this up a little bit. Yeah, so basically became a real community health center, a federally qualified health center in 1978. That just gives us a little bit different statuses to be a federally qualified health center. There's different benefits that come along with that from the federal government, and some grant funding that also happens with that. Our mission statement is very basic, just basically that we're dedicated to providing access to affordable, compassionate, high quality healthcare for all. And the key points on that is just for all. We are a clinic that sees anybody who wants to come to our clinic, but again, based on our mission statement, we are mostly here to make sure that the uninsured people and the people who might be underinsured have a place to come where they can afford dental care, medical care, behavioral health care, or anything else that they might need that we're able to offer them. And then we make sure that we are available to them with our funding. We are considered a primary care for medical, and then we also have dental services. Within our Waterloo building, we also have an urgent care. We have counseling services that will do everything from family concerns, family substance abuse problems, nutritional concerns. We have an on-site laboratory. We have an on-site x-ray for basic x-rays, and we do have a pharmacy on-site also. Other things that aren't on here is that we also have a homeless program, and our pediatricians do see patients in their hospital, so that if you're a kiddo and your kiddo gets sick, then our pediatricians will follow them in the hospital. And so we really like that service to be able to offer that. Our providers, we've been growing. When I first started with the clinic, we had 4 providers. Now within our medical system, we have 4 family practice doctors, 2 internal medicine doctors, 6 pediatricians. We have 1 midwife right now who helps us with the family planning. And we just started this week another women's health nurse practitioner. We have 8 mid-levels that are nurse practitioners and 1 physician assistant. And that's all on our medical side. On our dental side, we have 3 general dentists. We have another dentist that will be starting with us at the end of this month. So we're very excited to be welcoming her on board. And we actually have an interview for another dentist tomorrow. So still trying to get our dentist numbers up. My goal is to have 5 dentists. And so it's kind of a hard one to always keep staffed. We do have 3 dental hygienists. And we also have a dental hygienist that works within our pediatric department so that we have a integration of dental within pediatrics, so that we can keep track of the children to make sure that we're checking their teeth as often as we can and make sure that they get referred to the dentist as soon as they can, so that their teeth can stay as healthy as we can. The behavioral health providers, this is a big department we are trying to grow right now. We have 2, very proud to say we have 2 psychiatric nurse practitioners on board right now. And one of them focuses a lot on our adult population, and the other one was hired specifically for our pediatric population. We have another psychiatric nurse practitioner that will be starting in January, and that'll take us up to 3, and that's just fantastic. For counselors, we have 2 chemical dependency and addiction counselors and 4 social workers on board, and we do finally have a licensed social worker. So we are very, very excited about that. Our service area is a big deal for us with our funding. We always get asked, what's our service area? The biggest bulk of our patients come from the Black Hawk County area and the Butler County area. Doesn't mean we aren't seeing patients from all over. We have a lot of patients that are coming from the Charles City area and the Decorah area for our dental care. And they'll be seen, they mostly just come down to our Butler County site. Within Black Hawk County, we have people that come from all the counties around us for the different services that we offer. And so that is a really great thing. So we do have two facilities. Our main facility is in Waterloo. And within that place, let me tell you a little bit about that. We have, our square footage there is about 40,000 square foot. And we have 47 exam rooms, 2 treatment rooms, 8 dental operatories. We have rooms for meetings where we do have people like AA comes in here for meetings during the week. We have other community groups that if they need to have a community meeting, our spaces, if our space is available, they are welcome to use it. We do not charge any community groups to use our space if we have it available for them. We also have offices for counseling, nutrition, and homeless for our homeless program within our Waterloo site. Our other facility is Clarksville. It has been here for about 11 years, and it is a small little building on Main Street in Clarksville. If you're ever there, please stop in and take a little tour. It's a tiny little place. Square footage there is just over 3,000 square feet. We have 4 exam rooms there, 1 treatment room, and 3 dental operatories. We had started with 2, but the need was very big, and we were able to add another dental operatory for our dental program up there. So who do we serve? We serve all the patients in the areas that I talked about. And so looking at last year, if we look at the 2019 year, we saw over 18,800 patients, and we did over just 64,000 visits. We served over 931 homeless patients. We are trying to track our veterans here, and that number keeps growing, which is really nice. So we try to really work with the VA here in town, and we'll see patients here if we can see them quicker, or if they want to establish care with us. The VA, we have a nice arrangements with the VA that they're allowed to do that. So within that, our medical visits are over 45,000 in the year, dental visits over 10. Our behavioral health visits are growing every year. And then our enabling services visits, those are more like our homeless visits and our outreach services that we do. The demographics of our patients, we see people all the way from 0 from when they're born all the way until the end of life. And so you can kind of see that, how we spread out with that. The patient income, our focus for here is we really want to make sure that we are the place for people to come who need can't afford the insurance, or they're underinsured or uninsured. So you really do see that our patient income levels are mostly for people who are below the 200% of the poverty guidelines. And that is the mission of this clinic. Our race and ethnicity, we seem to be the home of the patients who are new to our community. So when we see new cultures come into town, a lot of times they find a home with us because we will have interpreters on site that help them. And not only are our interpreters interpreting, but they're also helping them understand the paperwork that's involved with getting their kids into school. How do they work with DHS? How do they work with any of the other systems in town? And our interpreters do a fantastic job with that. And so we do end up seeing a lot of non-English speaking people at our clinic. In fact, I think we have about 15% of our patients are best served in a language other than English at this time. We do take insurance. We are not a free clinic. We do have discount available, a sliding fee discount for people who qualify. But you can see that even within that, we do have 19% of our patients did not have insurance. Sometimes that's because they just can't afford it, and so they do go uninsured. We do have undocumented patients who do come here, and so they can't get insurance a lot of times. So that will fall under a lot of our uninsured patients. Medicaid is 45%. It used to be a lot lower. We were very blessed that Iowa did expand their Medicaid to the adult population. So a lot of our adults used to be uninsured, and our uninsured was over 30%. So you can see how that change in Iowa made a big difference to the community and the patients, the people around. 11% is Medicare, and then we do have private insurance, about 23%. And our big private insurances are the ones that you all would know, the Wellmarks, the Blue Cross Blue Shields, the United Healthcares, things like that. We are very proud of the work we do here. We strive for quality. And so what you see on this is that in 2019, and we just received this year and for 2020, we are considered a gold standard health center quality leader through HRSA. That means that we are in the top 10% of community health centers across the nation for our quality levels. We are a patient-centered medical home. That means we go above and beyond to make sure that our patients who need services are able to find them. We don't just say you need the service. We make sure we get them that appointment, make that referral, follow up to see that they got to the referral. Do you need anything else? Is it transportation? What is it you need? So we really try to pay attention to everything they need, which is considered a patient-centered medical home. In 2019, we did have a 2019 Best of the Best with one of our staff, and we also had a top 10 Cedar Valley nurse. We were considered a 2019 Employer of Choice, which we thought was just fantastic. We had never had that happen before, and that was really exciting. One of the biggest things that we're super proud of is that we are considered a top screener for colon cancer. We talk a lot about poop here at the clinic, and so that always kind of is interesting. However, with our patient population, we have been able to have over 80% of our patients who are due for colon cancer screening are compliant at this point, which is a phenomenal number. I think the national average is under 40%. And so that we are able to just really push that has been amazing. So we have received national recognition for that, and we consider to push that. We are using the same methodology for the colon cancer screening to push our mammograms and our pap smears right now and see if we can get those numbers just as high for our patient population, because prevention is always the biggest thing. The faster you can find that there's a problem, the better chance we have for our patients to have a better recovery. The other thing that we continue to work on our perception and image of the clinic. And this can, you'll see us advertising more, you'll see us at more events. You kind of see us really working with our staff on even how we look within the clinic, that the clinic looks nice, that we're looking nice, that we're answering the phone in the same way. Just that whole culture of really trying to show that we are here for the patients and that we are just a fantastic team to come here. So how did we respond to COVID-19? Well, we jumped in it with everybody else. And I remember in March when this all really started coming down to play, I was actually visiting with Senator Grassley's office and Senator Ernst's office when things were really starting to get hairy. And I remember thinking, I can't get back to Waterloo fast enough. There's just so much to do. What we did right away was we got involved in the EOC. We had our medical director, Dr. Duclos, and Dr. Newman would serve as, they would talk at a lot of those meetings. I'm sure you saw Dr. Duclos kind of have a really bad day one time and really talked about it online, and it went viral throughout the nation. But really her passion behind that was just seeing how our patients were really hurting from COVID. They were scared, they were sick. We've lost some patients through COVID, and it's been very hard for us to see that. But through the attention that we've received, it's the support we received locally here from the community. We received notes and just little gift baskets from everywhere from out east, from California. We've gotten notes from other board members from other community health centers that just, said thanks for doing what you're doing. And so that's been just amazing to see that. I wouldn't have dreamed that. But our passion for our patients really has come out for COVID-19. We've always had the passion, but I don't know that the community always saw that. We have agreed to be a Test Iowa site for this area. Basically, we're approached by the state and say, would you help us with this? And we said, sure, that's what we're here for. We are part of this community and we are ready to go. So to date, we've performed over 2,200 tests for COVID-19. One of the biggest things we probably have challenged with COVID-19 is we tried to stay open. We've had other clinics that we know of with community health centers across the nation who they got very nervous about COVID-19, as they well should have. And so they closed down. They did telehealth only. They would see people, they would do drive-up testing, but people didn't come in their buildings. They really tried to stay safe, which I get. We tried to stay safe too, but we used it by using PPE. We had people working from home. We put up barriers between people so that, because we're crowded here, and we made sure that, we got rid of chairs in waiting rooms. We, did all the things that people were told to do, but really pushed the PPE for our patients and our employees. And I think we did a very, very good job. We've had just a few cases of COVID that have hit our employees, and only one of those that we can track was a patient-related COVID. The other ones have been community spread COVIDs. So I think that says a lot for the practices that we put in place, that it didn't get through our clinic, it didn't go rampant through our clinic. So very excited about that. Really had to adjust our workflows. So we did do some telehealth, but we also knew that a lot of our patients who didn't feel well, they wanted to be seen. They wanted to talk to a provider, talk to a nurse, be reassured about what does this mean? And if their test came back positive, we made sure that they knew what they needed to do at home. If their test came back negative, then we tried to explain to them, this just means today. And how did we work with our patients who were just scared? COVID's around, we're in our 6th, 7th month of this, and it's not going away. So how do we learn to live our lives in a way that we're not so afraid that we're not leaving our house? So we work a lot with our employees and our patients on that. How do we still have a life with COVID? So that's been a big approach with our providers, and talking all the time and in our staff meetings, working with our employees. And our employees, I've always been proud of our employees, but this one just blew my mind. They stepped up, they came to work, they did what we needed to do. And we were in a rapid process changing mode all of the time, because you all saw it, everything changed by the day, what the recommendations were. So from a medical center, that meant sometimes you put in one procedure in place, and the next day it was invalid and you had to change that procedure. So the communication that had to happen was just amazing. And our employees stuck right with us. And so that has been just amazing. So what are the challenges we face? A lot of this we were already facing before COVID, but COVID made it even worse. Our space, we built our main building in Waterloo in 1999. We added on to it with our dental sometime within the next few years. And now we are COVID really showed us how on top of each other we are, and how that just doesn't work well. So we're really right now looking at our space and trying to figure out what do we need to do to get the elbow room we need, add the behavioral health that we really know is needed in this community for our patients, and trying to figure out what does that look like? How do we fund that? What's our plan? So we're still right now in that kind of a discussion mode right now with our senior leadership staff. Staffing, we are, if you've ever come here and have worked here, and I think I saw Kayla online, she's worked here before. We kind of have this thing here that people never really leave people's clinic once you've worked here. We actually celebrate our repeaters when it's their anniversary time, because a lot of people started here and different things happened in their life, whether they went back to school, they thought they were going to move, they moved back into town, things happened with their family life, and then they come back. And we think that's fantastic. So we really celebrate our repeaters, and our longevity here is amazing. Both of our medical directors have been here longer than I have, and I've been here 26 years. We have a CFO or a controller who's been here over 35 years. One of our providers, Dr. Bathan, has been here over 35 years. And a lot of our nursing staff and other staff have been here for a long time. So sometimes a newbie is considered somebody who's only been here for 7 years. And so we do celebrate that. However, because of our need in the community, staffing, always looking for staffing, looking for the nurse, looking for the aide, looking for a registration person, a biller or a medical record person, and a providers. Our providers, things change in their world too, and they may leave us. And to recruit here is sometimes challenging. We serve a different population, and to find somebody who has that same mission minded, we really want the good fit. We want them to interview us as much as we interview them. And so staffing is usually a challenge, but we work hard at it and get very excited when people do join our team. Funding, we're always watching our funding. We get some of our funding from the HRSA, from the federal government. Probably 25% of our budget is from the federal government. And out of a budget, I think I have an $18 million budget right now with over 170 staff people. So, you know, funding, when funding is on the cliff, and we're always looking for people who want to advocate for us and write to the senators and write to the representatives to say, hey, don't forget us here, sign that bill. Don't just let that sit there on your desk. We need this to go through because it makes a big difference to us. So we really, those are probably the biggest challenges that we face at the time. One of the things that I love about our clinic is, although people do lots for us, we really try to give back to the community at the same time. And so we support different things. We support the American Heart Association. We are very proud to be part of the graduation open house for area youth that are aging out of foster care. And we think that is just a neat project that as a clinic we've decided to give back to. We have been part of the AIDS Assistance Project Gala, the Debutante Cotillion, Culture Fest, the Mental Health Summit. We've been big supporters of that when those have happened. We love being part of the Pride Fest. That's always a lot of fun. We've done the My Waterloo Days Parade. We've been people in the park, National Cow Congress. We've really tried to get out there a lot more than we had in the past few years. And so hopefully you are seeing us. Hopefully you're seeing our banners. And hopefully you can see that we are trying so hard to give back to the community as much as the community is helping us. And I think our employees are very proud of that. And I am very proud of that we find ways to do that. Many times the commitment that we give isn't even out of the People's Clinic money. It's out of us fundraising for Jean's Days. It's coming from our actual employees when we are funding some of these events. And so that just warms my heart too. So other things that we do, this is a project we had just started a little bit before COVID, and we call it the Vitals at Home program. And we make sure we've got some funding where we are buying scales, blood pressure cuffs, different diabetic supplies, pulse oximeters, things so that when people are at home and we're trying to do a telehealth visit, we can actually get some vitals on our patient. And that's really important, especially if we're following a patient who has hypertensive needs, or somebody whose diabetes maybe isn't all that stable, and we really want to know how are they doing, but we want to be able to see them in a safe way when COVID was really bad. So we have been we give them away. We give away the scales and the blood pressure cuffs. We teach them how to use everything. A lot of our patients, when they were sick with COVID and we were trying to send them home and we wanted them to use fever reducers, well, they didn't have the Tylenol. They didn't have the acetaminophen to use. So we bought a bunch of that, and we'd make sure that they had that when they went home. Some of our patients would come in on the weekends and they didn't have much food, and we're sending them home to self-quarantine. So we worked out an arrangement with the local food bank, and the food bank would bring us boxes of food so that on the weekends, our urgent care could give patients boxes of food to go home with, so that they could go straight home and self-quarantine and start getting better and not worry that their cupboards didn't have good food in it or something to eat. So this has been a really neat program. I've received, and in fact, I believe the foundation money, this is specifically what we added to this program. Unfortunately, we had this great idea, but COVID just kind of slowed down everything. It probably took us over 2.5 months to get the scales, and they trickled in one by one. And so it's getting a little bit better now, and we're still moving forward on this program, and the patients have really, really appreciated it. Another thing we started last year was our People's Community Garden. If you've driven down Franklin, you'll see our garden out there, and it just keeps expanding. We have partnered with the university, with UNI and the AmeriCorps group, and we have funding right now. We received some funding from the Guernsey Foundation that is helping us, and some of that funding we haven't been able to use because of COVID, but we'll be adding a fence, and the fence isn't to keep people out, it's to keep the rabbits who have found nice little homes in our garden. And so we're trying to do that. The community has been so respectful of the garden. We do see some people come by once in a while and grab a cucumber or grab a tomato, and in my mind, well, they must have been hungry, And that's why we have a community garden, and they needed something to eat. So that's been good. What we do with the produce that we harvest from here is that we give it away to our patients. So 1 to 2 times a week, we will have distribution days, and our patients will, if they're here or they see the tent, they just come. There's no questions asked except how many people are in your family. We make sure they like what we have because we don't want them to waste the vegetables either. And if they need help on learning how to prepare it, we try to help them understand how to store the vegetables, how to cook them, and how what's good about them. We are in the middle of a food desert down here. And so to be able to give people affordable, free vegetables has been a big dream of mine. And I have been so excited that you and I worked with us to get this program going. And we have given away literally tons of vegetables. And probably our biggest seller are collard greens. We can't even plant them fast enough. Those go right out the door. And then we had a special request for hot peppers because apparently a lot of jalapenos in town really aren't that hot. And so we've actually are doing some of those that people have requested. We surveyed the local churches and our patients in the community before we figured out what to plant, so that we were actually planting things that they wanted. So this has been a fantastic project. We have people who come and volunteer. They come, the Boys and Girls Clubs have come, different youth groups have come, the UNI teams have come, volleyball, and I think basketball teams, I think both of them have come and helped weed the garden and done things. So it's also become a community outreach for other people to feel like they can help with this project too. So it's going fantastic. We've been part of the special project of Reach Out and Read since 2000. And basically it's to make sure that we are encouraging reading within the families. So little kiddos who are having their checkups here, 6-month checkups through age 5, will get a book when they're done with their visit. We have them in multiple languages, so that if it's a Spanish family, they'll get a Spanish book, so that those parents can read in the language that they're comfortable in. So not only is the child hearing somebody read to them, but it's some family moment time that's happening, and we're we have books. Outside of this, we also have used books, gently used books in our waiting rooms, that if it caught a child's attention, they are welcome to take it home with them. And so we are always looking for gently used book donations for our clinic, and we put them out. We also have adult books that we put out too, if they're not too, if the covers don't look too seedy, we'll put those out. And if adults would like to take a book to read, those are welcome to walk out our door too. And then a new project we started last year based on some grant funding that we received was Miles and Minutes. And basically what we realized that a lot of our patients were having trouble getting to their referrals because they didn't have reliable transportation. So the no-show rates for the referrals were high. And that was not bad quality of care for our patients, but it also was hurting our relationships with our referral providers in town. We want them to want to take our patients. We want them to schedule our patients, but we don't want to hurt their business either when our patients aren't showing up. So we received some money, and we're able to help people with rides, whether it's through Uber or our taxi services that are in town. And we really try to say, if you don't think you can make it to your appointment or your ride falls through that day, call us and we will get an arrangement for you. So we're hoping that that's made a big difference so far. And then phone, this is something different. It's easy to call a taxi, but the other thing we realized that through social determinants of health kinds of questions, you ask people, what kind of support system do you have at home? Do you talk to people much? Well, if you don't have a good, reliable phone and your data is, your minutes are limited every month, you may run out of minutes, and then you can't have a good social support also. And then as doctors, we can't reach you to talk to you about the healthcare needs that you might have. So some of what we've done with this funding is to give people phones with some minutes on them. If they already have a phone that maybe they got behind on their payments, we'll catch them up on their payments and give them a month's worth of something to see if they get their phone working again. And that's been a very interesting thing to do. There are so many different phones out there, phone plans. It was a little more complicated than I think we were expecting, but it has it's really been a very good service, and we've been very excited to be able to do it for our patients. The MAT program, this is a medication assisted treatment program, and basically it's to help our patients who are ready to stop opioids from controlling their life. It's a way to get off of opioids in a way that's a little more, it's safer for them to be on this program. So we work with them through our providers, took special training for this program, and we work with them and our social workers and our counseling system to help them get a life free from opioid abuse. So I think right now we might have just under 20 patients on this program, but we have seen some really good success in the program, and this has been very needed in the community. And so we're very glad that we were able to start this program. So what we're thinking about with opioids, you're looking for the people who are having trouble, with their hydrocodone, their oxycodone, their heroin, their fentanyl, their morphine. I don't think anyone, woke up that morning and decided they wanted to be reliant on an opioid. So when that happens, how do we help them to get off of that? And that's what we're here for. And so if you know of people that could use that, please let them know we have this service available to them. And then in 2019, we realized that our family planning options really weren't keeping up with what the rest of the world or the community was doing. So we did some other training. We went to the long-acting reversible contraceptive. We can do IUDs. We can do the implants and the Nexplanons in the arms. That's when we added our midwife and the women's health nurse practitioner to our team. So we're able to provide family planning care to women of all ages. We're willing to sit and talk to you about what's, all the different options that are available. And we're very excited that we started this program. So that is, in a nutshell, a little bit about us. I don't know if I'm doing okay on time or if I just wait way too long, but I'm willing to answer any questions. I don't know if, I think there's some questions maybe in chat I could look through.
Yes, there's some questions, but while you're looking at the questions, I want to make sure that our listening and our audience realize the magnitude of the services that you offer to those, the less fortunate in our community, and meeting their needs and having them transition into being self-supportive. But yes, there's several questions in the chat box, and if you want to respond to them, that would be great.
Okay, so it looks like mental health is a big topic. How are we adapting to that during COVID? So a lot of our visits now with our doctors, they're taking the time to talk to them. I mean, we always try to talk to our patients, but this is such a different topic. Again, kind of like I talked about, is trying to help them understand this isn't going away tomorrow. So how do we live with this? How do we not be afraid to get out of our house? So while things are kind of calm right here, we consider this calm, even though the world thinks we're a hotspot. We're encouraging our patients to come in. So we get them out of their house, see that it's safe to come in. We'll help you be safe. We'll show you how to wear your mask. We'll teach you how to work in this community so that you can still have a life. So that's kind of how we're doing it with that. Our social workers are following up with people, and we're using our behavioral health program to really work with people on that. Geriatrics, we haven't really looked at that. That's a really good question, Barb, to see if, no, we haven't, but that's a really good thought.
Because my book discussion group at the library is reading Elderhood, and she makes a very, very good case for that specialty, because as we age, those of us that are over 65, our body reacts differently to medication.
Right.
And we need a holistic approach. So it's a big read, Chris, but just to flip through it and see it's a physician that wrote it. So
Yeah, I will definitely put that on a list of things to think about. It definitely in the future. Our Medicare population, and which is kind of how we can tell our elderly population, has stayed very stable. It's not something that grows, which is interesting because I'm not sure it should be growing with the baby boomers and everything, but it's staying right around 10 to 13%. But I definitely will put that on our list to talk to our medical directors about.
And the other thing I had, when you deal with so many of the immigrants, my agency offers we have a tax preparation site where we actually have taught some of our immigrants to do the taxes so that they can come in and have somebody that speaks their language. Those folks are getting scammed really bad, and we're trying to hide that.
We do have a patient board, so if you have flyers that are in different languages, we would put those up on our patient board so they could see that the services are available. Just send them our way.
We have three Burmese and 2 Congolese that we trained last year. Of course, everything got cut short because of the pandemic, but we were at Hawkeye. Hawkeye let us use that big room on the
Mhm.
Okay, in order to get all the questions answered in a timely manner, what I'm going to ask if Chris can respond very succinctly to the remaining questions.
Sure.
And then if you have any questions for Chris, you can email through us or email her directly.
Sure.
Please
So the next
proceed.
question talks about volunteer opportunities. So we don't really have a lot of extra people in our clinic right now because of COVID, but, and I don't know that we have much for virtual. We're always looking for people to make masks for us, especially kids masks. We're going through those. If patients don't have masks when they come in, we're trying to send them home with some cloth masks. So masks are a big one. And then there is always room in our garden. If you want to come and be outside and weed, we're very open for that right now. So we have a nutritionist on site. Do we partner with any nutritionists while giving away? We have worked with the Iowa State Extension Office last year. They haven't come this year with our stuff because of COVID, but they used to be at our distribution table with our vegetables and gave us the stuff we needed for that. And that was a great partnership for that. And our nutritionists, actually, we have identified, I think we have 15 people that we are delivering boxes of vegetables home with them. And she's working with them directly on the vegetable that they're getting so that it works with the program for them. So that's been working out really well. Do we take donations at any time? Well, of course, we would always take donations of any size. And so on our website, there are ways that you can designate where your donation would like to go. If it's with our homeless program, our Reach Out and Read program, just within general operations, because people don't always like to give to just general operations, but that's what kind of keeps our doors open. We have a place there for the garden also, that if you wanted to put some money towards the garden, we're always looking for a new hoe or a new hose or things like that. And our seeds cost money. We just did the garden regardless of, there's no return on investment on my garden. It's so always looking for those kind of donations. So thank you for that question. And I see the question about confidential services to teens. Yes, we do. We do have a program with that and are able to work family planning kind of options with them, the STD kind of things, all the things that we are allowed to do teen only kind of visits with. We do that. And we have a way within our electronic medical record to identify those visits in a way so that hopefully you're always hoping that it's not ever discoverable by accident by a parent. So we do really work with that. We try to communicate with the teen that, communication with your parent is probably your best option. But yes, we will do confidential visits for our teens within what we're required to by the law.
On that note, I want to thank everybody for logging on and being a part of this, Windmills on Waterloo. And we look forward to doing many, many more. And the one thing I want to take away from Chris's presentation is that I think we all need to remember that in order to serve the Waterloo community, and the greatest need is that we need to be willing to change. When things are not working properly, we need to be willing to change. And with this COVID, and we don't know what tomorrow's going to bring, but we have to prepare for it. And Chris, I think your organization is meeting the needs, not only the medical, but almost every aspect of an individual need. And that's what we need to know. And I'm glad that everybody logged on, because we want to hear more stories about what people are doing, because that makes our community whole when we know what everybody's doing. And that makes us a more powerful unit when we can relate to each other and know where to send our participants to receive services. And on that note, I would like to say, once again, Joni Spencer, Together for Youth, will be our next presenter, and that's Thursday, October 1st. And we would love to see all of you back again. And once again, Chris, you did an outstanding job. Thank you. And thank
Thanks
all
for
of
having
you
me.
for
Appreciate it.